hope, and courage. A tribute to breast health on ABC 27 is presented by Penn State Milton S. Hershey Medical Center.
And welcome back. According to the National Cancer Institute, women in their 40s and older should have mammograms every year. Doctors say early detection of breast cancer can save your life.
The leaves change their colors around the same time every year. And around that same time, 44-year-old Chris Borges comes to Penn State Hershey Breast Center.
Hi, I'm Chris. I'm here for my mammogram.
Well, hi, Chris. I'm glad you made it today. Come on in.
Chris received a letter reminding her of this very important anniversary.
And I've been doing that ever since I turned 40. I actually had a screening mammogram at 35. And then at 40 you start yearly. So this will be my 4th yearly mammogram.
A husband and their 2 daughters keep her coming back.
Yes, I have fear going into it that something's going to turn up, but you know, I have a bigger fear that I won't be around for my children, so this is something very simple that you can do.
And take your right hand and hang on to that bar.
It doesn't hurt. It is just a little bit uncomfortable, but it just really lasts a few seconds for them to take the picture, but other than that, then afterwards you don't feel anything.
Mammograms usually take between 5 to 10 minutes. The next step is for the radiologist to read them.
In this case, it's Dr. Susan Shetter. She takes a close look at every detail.
When we're looking at the mammogram, we're looking for a number of things. One is an obvious mass or a tumor, something that shows up as a white spot on the film. We're looking for those areas as well as areas of microcalcification. Microcalcification show as tiny little snowflakes perhaps on the mammogram, tiny little white dots. And then we have to do magnification views, extra views of those to see what their character is and determine whether or not they would require a biopsy.
Dr. Shetter says a mammogram is a simple procedure that can save your life.
If we find a breast cancer that is a small breast cancer, it is less likely to involve your lymph nodes. And right there, you are already on a road to recovery and survival that is essentially a cure.
So far, Chris's results have been negative.
Although there's a little asymmetry in the left breast, when we look at the images compared to the prior studies, the right breast is absolutely stable. So this year your mammogram is very stable, and I don't see any findings of any concern.
That's great.
Great news for Chris, and even better news for her family.
Well, joining us now is Dr. Susan Shetter, the co-medical director at Penn State Hershey Breast Center, and is with us now. And if a woman's mammogram has been normal year after year, is it still necessary to get this test?
Absolutely, Chuck. We depend on an annual mammogram for the early detection of cancer. So when a woman's risk of breast cancer increases with age, we know it's important to keep getting those annual mammograms as the risk increases.
Now, is it true that mammograms don't find all types of cancers?
Well, there's a very small percentage of cancers that mammograms do not detect. But mammography and the annual mammogram is the only proven way to find an early cancer, and actually that test is the only test that has been shown to decrease the mortality of breast cancer.
Well, since mammograms may not show some cancers, what other way can a patient get screened?
I wish I could say that there were lots of different ways to screen, because mammograms aren't always the most popular test. People have studied ultrasound. It is not yet proven to help. For very high-risk women, women who have first-degree relatives with cancer, women who have had Hodgkin's disease, they can get an MRI as a screening tool, and that has been shown to be very sensitive to pick up the small cancers that a mammogram may miss in those high-risk women.
Someone first diagnosed might think, this is overwhelming. My choices are too many, but there's a lot of options, too. There are a lot of options, which is good.
Absolutely. Really, we want to steer women to the mammogram. An annual mammogram with a clinical breast exam is their tool to be healthy and to stay healthy. If we can detect that cancer early, then we know that they have a great chance at cure.
Well, Dr. Shetter, thank you very much for joining us here tonight. I said time flies on these shows. That's what I'm saying. We're going through that. And if you'd like to schedule a screening mammogram, you can call anytime. They're open 24 hours a day. Call 1-800-243-1455 or go to the website listed on the screen. And Deb, Pinkerton's in the call center. Deborah, still busy in there, I take it.
It is still busy, Chuck, and we do have another viewer question. I had breast reduction surgery and was told my breasts are very dense. Did the reduction procedure put me more at risk for breast cancer?
No, that procedure does not put you more at risk. And actually, breast size does not increase or decrease your risk for breast cancer one way or the other.
Okay, great. Thanks so much. We'll check back with you in just a little bit. Chuck.
Thank you, Deborah. I'm supposed to take a break right now. That's what we're going to do. We have another doctor coming right up.